Radiology is an essential tool in the dental field because it allows us to make a correct diagnosis and treatment planning. Thus, dental radiography allows us to see structures that we may overlook at the patient's first visit or during conventional clinical examinations. There are basically two types of X-ray films, the intraoral and extraoral radiographs. Within extraoral radiographs, we have the orthopantomography, known as panoramic radiography. We also have the lateral teleradiography, or profile view of the skull. We also have computed tomography, CT, and cone beam computed tomography, CBCT. Plan Mecha Group, a pioneer in CBCT devices, developed the Promax 3D. The main advantage of Promax 3D is to unify all extraoral radiography systems in a single device. This means that with the Promax 3D, we can make a panoramic radiograph, a lateral teleradiography, and a CBCT. Unlike conventional CT, CBCT emits a very low radiation dose. Promax 3D has a preview before the final shot. This 3D preview represents approximately 2% of the total radiation. Doing this preview, we can obtain three-dimensional images at very high resolution with minimum radiation. There are basically three types of intraoral radiography: periapical radiography, occlusal radiography, and bite-wing radiography. Periapical X-rays are perhaps the most used or most common in dentistry because they allow us to see any kind of dental pathology and also allow to track different clinical procedures such as root canal treatment or fillings. The bite-wing radiography allows us to visualize interproximal caries, secondary caries, and the status of the pulp chamber. It allows us to view the status of these cavities in relation to the bone crest. And obviously, if it has any vertical bone or horizontal bone defect. We can also see if there are interdental calculus or tartar, which already gives us a general idea of the periodontal condition of the patient in that area. And finally, we have the occlusal radiograph. The main function of the occlusal radiograph is to observe pathologies in the nostrils, in the maxillary sinus, or also to look for possible fractures at anterior teeth. It can also give us an image of the presence of small stones in our salivary glands.